Good afternoon, everyone. I'd like to extend a very warm welcome on behalf of the Global Health Hub Germany. First of all, of course, to MPs Alistair Strathern, Member of Parliament in the House of Commons in the UK, and Sascha van Beek, Member of Parliament and the Health Committee here in Germany in the German Bundestag. Also, a warm welcome to Peter Baker and Tim Shand from Global Action on Men's Health, who we are collaborating with on this webinar today, and colleagues from the German Men's Health Foundation, as well, of course, as all of you, dear participants. My name is Corinna Heinecke, and I'm the director of the Secretariat of the Global Health Hub Germany, a network of more than 2,300 members from 8 non-governmental stakeholder groups, which bring their perspectives into the political dialogue with the German Bundestag and German line ministries working on global health. For years, the Hub has addressed gendered structures in access to health services and representation in health research, especially through one of its 10 Hub communities of practice, the Women's Health Community. It is great, we think, that we can today complement this focus and ask how gender affects health outcomes for men. The effect of gender barriers on access and health outcomes will also be addressed in one of the sessions at our Global Health Talk on 7th and 8th of July, and we would be very happy to see you there. So we will take up what was discussed today and also complement it again with the women's perspective. I'm very pleased about the collaboration with the Global Action on Men's Health Network and the German Men's Health Foundation. And I thank you very much for sharing your expertise on this matter. And I hope all you participants enjoy the discussions today. And I'm glad to now hand the floor to Peter Baker, the Chief Executive of Global Action on Men's Health. Thank you very much.
Thank you very much, Corinna, and a very warm welcome to this webinar from me at Global Action on Men's Health. We're delighted to be hosting this webinar with Global Health Hub Germany, and that the Hub is committed to engaging with men's health issues. I'm sure I don't need to tell anybody here that across the world, too many men are dying too young. But this is poorly addressed in health policy, and that's what Global Action on Men's Health, with its partners, is trying to change. We want to see more national men's health policies in Europe and across the world, and we also want all health policy to take account of the specific needs of both men and women. And it's important to stress men and women because we shouldn't be making a binary choice here. We can do both. We can do better for men and we can do better for women. So we look forward to continuing to work with Global Health Hub Germany, the Men's Health Foundation in Germany, which is one of our key partners. And if anybody else watching this webinar, taking part in this webinar, would like to get involved in our work or find out more about Global Action on Men's Health, please contact us or look at our webinar. The link will be posted in the chat. So thank you for your interest and support, and let's now get on with the main event. Thank you.
Great. Thank you so much, Peter. Thank you, Corinna, for setting the scene, for welcoming everyone. My name is Leonie Kienzler. I'm also working for the Global Health Hub Germany, and I will guide you through the next roughly 65 minutes today. Also from my end, a warm welcome. It's a pleasure to have you here. I see we have 51 participants already. That is great. Before we jump into the topic, I have a couple of housekeeping remarks. Not sure this is still necessary since COVID. We're all professional in webinars, but still, we are happy to have you here. I can't see you, we can't see you. So that's why please make use of the chat box. We would like to invite you to type your name, your organization, where you're logging in from. So let us know who you are. We'd love to know a little bit who's attending today. And I see that already a couple of people are doing that. So feel free to follow that example. During the webinar, you will have the chance now to listen to a couple of exciting speakers. If you have questions coming up, comments, ideas, feel free to use the chat box or the Q&A box. The chat box, you can just type in your thoughts, comments, share your thoughts. In the Q&A box, obviously, you can ask questions, and then we will try to feed them into the discussion in the moments where we have Q&A planned. There will be 2 of them. I will explain that in just a bit. And again, just the invitation to take part, to be present, to ask your questions. And an information, the webinar will be recorded. So if you miss something, you will have the chance to look at it again. And it will be posted on the website of Global Action on Men's Health and Global Health of Germany, and on the Global Action of Men's Health YouTube channel. All right, so then let's jump in. We want to talk about men's health. Men's health. Peter already said it, Corinna already said it. We, at least in Germany, have more experience talking about women's health. And even sometimes when I tell colleagues or other people that we are talking about men's health, it's perceived as a kind of a niche topic or something we should not focus too much on because it may take away attention from other important priorities. But today, we don't want to follow that line of thinking, because there are, if you look a little bit closer, really shocking and very, very relevant topics we have to talk about. I guess the shorter life expectancy in men than in women may be known already to many of you, but who really understands why that is? Who can really explain it well? And the higher suicide rates globally in men than in women, isn't this something we can do anything about? Is this something we don't want to address? So I'm sure the answer is no. I'm sure the answer is, let's look at these challenges. Let's look at it not in a binary way, like Peter said, but as 2 sides of the same coin, finding solutions to make sure no matter what gender, men, women, or anything in between, let's tackle the specific health challenges we find. Today, hopefully, we get you closer to a great understanding of that by listening to the speakers you can see on the slide now. The top row you already saw and heard now, and the top row, these are the speakers who will really fill you into the details of men's health now. We first will have the chance to listen to Mr. Sascha van Beek. Mr. Sascha van Beek is member of the German Bundestag and spokesperson for men's health in Germany, and he will talk a little bit about German priorities on men's health, both nationally and internationally. He will be followed by Mr. Alistair Strathern, who is member of the UK Parliament and also co-chair of the Labour MP Men and Boys Group. And he will talk a little bit about the UK men's health strategy and also opportunities for more European collaboration on the topic. After that, we hopefully have around 10 minutes for Q&A. So if you have questions, again, to Mr. Strathern or Sascha van Beek, please post them in the chat box or the Q&A box. Then after the policy perspective, we want to move more into a civil society perspective, and we'll have the chance to hear from Dr. Tim Shand from the Global Action on Men's Health Network. He will explain us more in general, why is men's health actually important? What are global trends that we have to address? And also some suggestions and ideas about closer collaboration across Europe. And then last but very much not least, we will hear from Doris Bardele from the German Men's Health Network, the Stiftung Männergesundheit, who will talk about the history of their work and also findings from their male health report. And then in the end, we will have another Q&A session, and then we will leave you hopefully a little bit smarter than you are now at 3:15 p.m. in a sunny afternoon. All right, that being said, I would like to hand over to our first speaker now, and I invite you, Mr. van Beek, to take over. And if you want to switch on your camera.
Yes. Hello, Leonie. I think my camera must be on.
Yes.
And I hope yeah, it works. Perfect. Yeah.
We see you, we hear you.
Perfect. Hello, everyone. Hello, my honorable colleague, Alistair. Thank you for the opportunity to speak about a topic that is often overlooked also in Germany, but highly consequential in its men's health. And if we take the data seriously, it tells us a clear story. Men in Germany live on average 5 years less than women, and that gap alone should be a reason enough to act. But the picture becomes even clearer when we look at everyday behavior and health outcomes. Over 40% of men in Germany are overweight. Only 1 in 4 eats fruits and vegetables daily. Men smoke more, drink more alcohol, and consume more red meat than women. And these are not marginal differences, they are structural patterns. And men also engage less with the healthcare system. Preventive screenings are used less frequently. More example, participation in collateral cancer screening and dental checkups is constantly lower among men. And this means diseases are often detected later with worse outcomes. At the same time, men face higher risks in other areas. Workplace accidents are 3 times more frequent, and perhaps most alarming, around 72% of suicides in Germany are committed by men. And I think this is not just a health issue, it's a societal issue. So where do we stand politically in Germany? There are important initiatives underway. Suicide prevention is gaining attention. Dedicated Suicide Prevention Act is part of the coalition agreement, and a new draft is expected. We have a national suicide prevention program and a strong cross-party consensus in parliament to move this forward. In research, Germany is making progress. Gender-sensitive medicine is increasingly recognized. The Federal Ministry of Research is addressing the gender data gap in clinical studies, main focus on women, but there are also projects on male infertility, on gender-specific drug responses, and on diseases such as prostate cancer. The Federal Ministry of Health is also active. The statutory health insurance reform includes preventive elements, and gender aspects are being integrated more systematically. And there is a research focus on gender and health, including pilot projects like Healthy Dads, Healthy Kids, and the evaluation, and I talked about that last week with Doris Bartley about such good projects, community-based approaches like the Men Sheets. We are also moving towards integrated gender medicine into medical education. That is a necessary step. Future doctors must understand that symptoms, risks, and treatment response can differ significantly between men and women. So, however, despite these efforts, one central problem remains: we lack in Germany a coherent strategy. We have many good initiatives, but they are fragmented. There is no central accountability, no dedicated structure that ensures continuity, evaluation, and scaling. And as a result, missing programs often end and there is no long-term impact. Men's health is still too often treated as a side aspect of policies, and that is not sufficient. And if we are serious about improving outcomes, we need a dedicated men's health strategy. And what would that look like? First, we need institutional responsibility. This could be a dedicated division for men's health within the Federal Ministry of Health, or a broader national center for gender health that includes a strong focus on men. Second, we should align our approach with international frameworks. The World Health Organization already outlined a men's health strategy in 2018. We don't need to reinvent the wheel. We need to implement and adapt this in Germany. And third, we should learn from countries that are ahead. Ireland was the first to introduce a national men's health strategy and now has one of the highest male life expectancies in Europe. Australia has a pioneered community-based approach like men's chats and successful prevention programs, and others such as the UK. We learn about that more later, and Canada are moving in the same direction. So fourth, the strategy must cover the entire life course. Boys and young men are increasingly exposed to rigid and often harmful norms of masculinity, especially through social media. At the same time, there is a long phase in adult life where men have little or no contact with the healthcare system, and we needed targeted entry points. And fifth, we need to close the specific gaps in care. And I think one focus is depression. Depression in men is often underdiagnosed because it presents differently. And we have a lot of other cases I can talk about. And I think particularly when we look on HIV, there we have still a relevant underestimated point in the vaccination for boys. So finally, we need to involve civil societies, organizations such as Stiftung Männergesundheit oder Bundesforum Männer are networks for boys and men's health are essential partners. They provide access, trust, and practical experience. And let me be clear that it's not about prioritizing man over woman. It's about recognizing differences and addressing them appropriately. A modern health system must be gender sensitive in both directions. And in Germany, we have a lot of knowledge, the institutions and the resources. What we need is focus and structure. And I think men's health must be moved from the margins to the center of health policy. And I'm happy that we are today together to focus on that. Thank you very much.
Thank you so much, Mr. van Beek, for those insights. Thank you also for sharing the relevance of a men's health strategy. I think you put it, if we are serious about their health outcomes, we need a dedicated strategy for it. Thanks for the reminder, and also for showing that apparently it worked in Ireland. That's very interesting. So now we are curious to hear about the UK experience. So Mr. Strathen, I hand over the floor to you.
Great, following on from Sasha, because I think, as with all of these problems, they are obviously national in some of their elements, but fundamentally, I think reflect trends and challenges that lots of us are grappling with globally. And so the opportunity, I think, to collaborate, particularly with close European partners like Germany, as we start our own journey in delivering on our men's health strategy and trying to ensure that we've got a real laser-like focus on some of the gendered elements, both for men and of healthcare provision, working closely with partners right across the globe to ensure we're learning from each other and getting this right is going to be so important. My name's Alistair. I'm the Labour Party MP for Hitchin in the United Kingdom, but I'm also the co-chair of the Labour Network for Men and Boys. We set up the group because fundamentally, I think we recognise that while as progressives and parties have left, we've got a very proud and long-standing tradition, we would say, of standing up for equalities issues, and particularly when it comes to women's liberations issues, trying to take on some of the forms of misogyny that we've seen right across British society over the last decades. That sometimes tended towards a reluctance to sometimes feel so confident in speaking to issues affecting men and boys growing up in Britain in and on their own terms. And that matters for a whole host of reasons. It matters not just because it's wrong-headed to view these issues as zero-sum. You know, we all live in a society where we care about each other, and that goes across both genders. And in fact, it's quite striking that in the UK, when you speak to women, one of their main concerns often about health tends to be men's health and the seriousness with which their own partners take health concerns in their lives. But it's also got real policy implications too, and whether it's some of the challenges and the particular challenges that men can face in education or the workplace, or the very real challenges that men can face in the healthcare settings in the UK, there are real consequences, I think, of that lack of political focus and lack of confidence sometimes in speaking to the gendered issues that can affect men and boys in and of their own terms and on their own merits. Now, that isn't to say that, we don't have big problems with some of the challenges women have faced in the healthcare system in the UK. I think it's, there's a well-versed and well-discussed literature about the levels of misogyny women can face in healthcare settings and some of the long-standing lack of focus on some of the particular conditions affecting girls and women in Britain today that have been allowed to persist without significant medical research and intervention for far too long. But alongside that, that shouldn't blind us to the very real gendered gaps in some of the considerations about men's health issues too. And the picture there is really quite stark. Men on average live for 4 years less than women in the UK. For men under 50, suicide is the leading cause of death. And on a whole host of particular health issues affecting men, there has not been enough focus from our National Health Service in either trying to understand with intellectual curiosity the drivers and the underlying gendered drivers of some of the issues, nor ensuring that the healthcare service in Britain can be as responsive as possible to some of those needs. So the Labour Men and Group for Men and Boys has been agitating for some time now on the need for the UK to step up in this space. And we were very, very excited to see the United Kingdom bring forward its first ever men's health strategy as part of its efforts. Now, just because we are, one of the first G7 countries to have a men's health strategy, I don't want to suggest for 1 second that that's because we're leagues ahead of anyone or that we're anywhere close to mission accomplished. But I think it has marked a really important milestone for us in recognising right from the centre of government that there are particular gendered natures to some of the healthcare challenges that men and boys can face right across the country, and to ensure that we're starting to have a much stronger strategic focus on understanding these, unpicking these, and tackling these as we look to improve the delivery of healthcare services for everyone across the United Kingdom. Now, there's a whole host of lenses to the strategy, and if you haven't had a chance to look at it, I would thoroughly recommend picking it up because it covers quite a wide range of areas. But I think there are two important lenses to it, which I wanted to talk to first and foremost today. The first is looking to try and break down some of those barriers to men presenting with healthcare needs far earlier. We know for a variety of societal reasons, men are much more likely to take far longer to go to the doctor to raise an issue when they are experiencing health challenges. And so as a result, if we're serious about men's health and we're serious about intervening in men's health in the most effective way possible, trying to ensure that we can support intervention strategies that help break down barriers to men seeking healthcare support and healthcare intervention where needed is really important. And whether it's the work the strategy is looking to do to partner with the Premier League and football teams across the UK to bring mental health conversations and interventions into sports grounds across the country, whether it's a partnership with EDF in Britain to start to test out what workplace-based interventions and conversations around men's health might look like on the ground, or whether it's the work of the strategy to start to look to fund more community-based interventions and support groups specifically focused on men's health right across the country. I think there's a real consistent thread throughout the strategy of trying to think through how we can do a better job of meeting men where they are now, break down some of those stigmas around healthcare conversations, and ensure that men feel more comfortable seeking support at the earliest possible opportunity where they need it, whatever their healthcare need. Now, alongside that, I think a big and broad part of the strategy is really looking to focus down onto some of those areas where we already know gendered challenges exist, or particularly gendered needs exist when it comes to healthcare, and design strategies to focus on them in a far more specific way. And whether that's the work being done to build out far more community-based mental health intervention, recognising the particular toll and risk that mental health and suicide is for far too many men in Britain today, whether it's the work to try and drive up better diagnostic awareness and screening around prostate cancer with a far stronger focus on those men who are most likely to be at risk, or whether it's some of the specific pilot interventions we're starting to bring forward on everything from lung conditions in areas where significant proportions of men historically have worked in coal mining, or tackling some of the particular issues that older men are likely to have with issues around cocaine and high drug addiction. I think there's a whole host of specific early stage work now initiated by the strategy to start to think through in a far more focused way where those gendered healthcare needs exist and what more appropriately designed strategic interventions need to look like, recognising the particular needs of men and the particular barriers sometimes to men getting and receiving the help they need. Now, like I say, we are very early on in that journey and there is a lot to do. We're lucky to be partnering as part of that strategy with a lot of fantastic community sector and NGO organisations that have been working in this field for a very long time now. But we're also very aware that we're going on this journey with international partners. And that's why I think conversations like this are going to be so important to ensuring that we're learning from each other along the way, learning from what works and where strategies aren't maybe as effective as they might seem like they could be on paper. And it's why I'm so happy to be here today as part of this conversation.
Thank you so much, Mr. Stratton. You keep saying that you're very early on and far from mission accomplished. It sounds still very impressive what you already did. So thank you for filling us in, for taking us with you, and also reminding us that we want to learn from each other, because in Germany we are still in the process, or we are still waiting for this strategy on men's health. And we have a couple of questions even on that in our chat box. And I would like to start from the beginning to pose the question to Mr. Sascha van Beek again. And the question is, what are the present government plans to develop a men's health strategy in Germany? And will that involve consultations with experts and NGOs working in the field, similarly to what we just heard from Mr. Stratton? So, Mr. van Beek, would you like to reply directly to that question?
Yeah, absolutely. When Alastair is saying they are in the middle of the mission and not on the end of the mission, I have to be honest that we already don't start the mission in Germany. And unfortunately, I don't see any activity at the moment. And so what can I do as a parliamentarian? And I think brings this up to the ministry, and I will do that in my responsibility for men's health as a parliamentary of the coalition. But I mean, the truth is, I do that, but we have a lot of other topics on the agenda. But sometimes, and that is what I have to learn as a parliamentarian, sometimes you have the momentum, and you have to use the momentum. And then it's important that you have always the topic men's health, in my case, on the agenda, and maybe I'm in the right moment that we start, or we can start on a strategy. And sometimes, and that is also a success, sometimes it's just a sentence in a future coalition contract that goes on that topic of men's health. And so I will say I use every opportunity to bring that on the topic in the ministry, in my party, and in the coalition.
Thank you very much, Mr. van Beek. We have another question for you, and also a quick comment from my end, because we will also hear from the Stiftung Männergesundheit a little bit later. And they also posted in the Q&A box that they submitted a strategy for men's health in Germany to the Bundestag a while ago. So we will hear when they speak for sure a little bit more, and that can probably also help you to keep that momentum up. So I'm excited to hear more later. But the other question to you would be, if there in Germany we celebrate days like Men's Health Week or International Men's Health Day to promote men's health and maybe to even build that momentum we're trying to build here now a little bit more strongly.
I mean, we have a lot of these days. I mean, we have the whole November as the month of health, and in my first year as rapporteur for men's health, I was wearing the mustache, and a lot of colleagues was talking about that with me. So I think that is one point where we had to go on that. And I talked to my chair of the parliamentary group, Jens Spahn, that maybe there is opportunity to get a session, actual session into the parliament in next November, that we can highlight this topic in a parliamentary session. Same thing. There are a lot of ideas to do that special sessions into the parliament, but I work on that, and I think we have a lot of time until November that there is one day in a parliamentary session inside the German parliament, 1 hour about men's health. So that is where I work on.
Thank you so much. I would like to pose the question to you, Mr. Alistair Strathern, also from the Q&A box. And it's about mental health. You talked a little bit about also the specificities on mental health in men, obviously, in your talk, but how much attention is given to mental health in the men's health policy, or maybe also in general health policies you have in the UK?
Generally in the UK, we've been on a journey when it comes to kind of prioritising mental health within the healthcare system, within healthcare settings. I think it's fair to say we've still got a long way to go. And as ever, our public are ahead of us. It's very clear in all of the polling now that the UK general public see mental health as on parity with physical health, and they'd like to see it treated as such by our National Health Service. But as a result of, I think, structural underinvestment over many decades, it would be fair to say there are still quite a lot of significant pressures on our clinical mental health support system to ensure people can get and receive the support they need at the earliest possible opportunity, and particularly to the level they need when it can really escalate. Now, within the men's health strategy, there's rightly a very big focus on mental health, because we know that suicide is the leading cause of death for men under 50, and there's been a kind of growth in conversations around mental health generally in the UK. It's fair to say that there's still sometimes a bit of a stigma for men in particular in opening up about their own mental health challenges in a way that they feel comfortable and confident doing, and is consistent with their own kind of self-identity as a man. As ever, on the ground, people have been leading the way. So we've got some fantastic grassroots groups that have been trailblazing on effective interventions in this space. And whether it's grassroots men's mental health walk and talk groups set up to try and create spaces for men to talk about their own mental well-being in the community where they live, whether it's men's sheds, which are a particular organisation with small shed bases right across the country, set up to bring men together to tackle isolation and to create spaces for men to have open conversations around their own well-being, or whether it's the work of particular groups like Andy's Man Club, who again started out as a kind of standalone group but have built into a network of fantastic clubs across the country where men can talk about how it's okay not to be okay and get comfortable expressing their own feelings and their own mental health challenges amongst peer groups. I think there's a lot we can learn from those types of community-led interventions and the confidence they can give men in speaking to their own mental health challenges in spaces where they feel most comfortable. And our mental health strategy very much looks, rather than contradicting that, to build off it. So a lot of the lenses through which the men's mental health strategy looks to take forward delivery of mental health support for men in the UK is through those community settings, either through looking to boost and support those groups directly, or looking to find other places where men already are, like that really important partnership with the Premier League as a pilot, to start to think about how we can take those conversations into settings where men are already, rather than trying to force them to break down a barrier to going somewhere where they're already quite resistant, as we know from all the evidence, to seeking help and support.
Thank you so much, Mr. Strathern. We have a lot more questions actually in the chat, but unfortunately we don't have time to answer all of them. So I would like to ask one final question to both of you, Mr. Strathern and Mr. Van Beek, also because we are trying to look at that topic, obviously internationally between Germany and UK already, but also a little bit globally. So do you have any plans, or do you see any opportunities, both of you, to also raise the issue of men's health internationally? For example, by raising it at the WHO or other global institutions working on health. Maybe Mr. Strathern, since you just spoke, do you want to continue? And then Mr. Van Beek, you can close.
I think there's a whole host of particularly gendered challenges facing men and boys that aren't national, they're international. And health, I think, is definitely one of them. Some of the challenges around life expectancy and mental health that Sasha was talking to could have been taken straight from my own notes to talk to you all about today from a UK perspective too. And while there will obviously be inherent national nuances to the types of intervention that will be most effective as a result of culture and our own healthcare system designs. The principles, I think, will try to take on, i.e., this is not a zero-sum game. This is an issue of equal merit with women's health, because whether male or female, everyone's health should matter equally. And if we're failing to consider the gendered aspects of that, we're failing to design healthcare interventions effectively. But also some of the historic, I guess, challenges that men have faced in accessing and feeling comfortable accessing healthcare support at the earliest point of need, they're internationally common. And so I think both through those existing international forums, but also through seminars and events organised by fantastic global groups by yourself, I very much hope that this is a conversation that's only going to grow and grow globally, because as we all start our journeys seeking to take these issues more seriously and design strategies with far more sensitivity to some of the gendered aspects of men's health, we're going to learn a lot. And whether it's learning what's working well or what's not working quite so well in terms of the interventions we're planning out and piloting, the more we can crowd together on these challenges, the better the outcome I'm sure will be.
Thank you, Mr. Strathern. It's so hard to add anything now, Mr. Van Beek, but do you still want to try?
Yeah, and to make it easy, I can absolutely relate to everything what was Alistair saying. And I think the issue, I mean, we have in all challenges in health systems or in all health problems, we have to bring more the male perspective into all challenges. And so we have many networks. We have networks specialized on men's health, but we have also networks in interparliamentary groups for health, maybe the Unite Global Network. There is a big conference in Manila this year, and when I look on the schedule, then maybe there could be more about men's health, and I think that is where we have to work on it in all the networks we have. Maybe on the World Health Summit, or on side events to the World Health Assembly, or on the Unite Parliamentarians Network summits, there must be more about men's health on the schedule.
Thank you very much, Mr. Van Beek. Actually, this collaboration comes from the World Health Summit last year, where the Global Health Hub Germany and the Global Action on Men's Health met. So yeah, I think you hit the spot. Thank you so much. Then I would like to continue the program, and I would like to hand over the floor to Dr. Tim Shand as the first civil society speaker in this webinar, and tell us a little bit about key men's health challenges globally and some ideas for improved European collaboration. And of course, a dearly thank you again to our parliamentarians who were here and are here today. Tim, I can see your slides already. Over to you.
Great, thank you so much. And thank you once again to Alistair and Sasha for that really rich conversation. And one thing I just want to say, kind of as I introduce, is both to Sasha and Alistair, is that we will be at the World Health Assembly. We would absolutely love we will have events on men's health, and we'd absolutely love to engage both the UK and the German government in those. We've extended an official invitation to the UK government, and Sasha, would be thrilled if you are there, or if members of the German government are there, to participate in our events on men's health. And we will be back again at the World Health Summit also, and Sasha would be thrilled, especially given that it is in Germany and will be in Berlin, to engage with you. And I think there's really interesting work that we can do together. I want to kind of bring the conversation back, really building exactly on where Alistair and Sasha have left us, to think about, well, why is this an important issue globally? Why is it also important for everyone's health, as has been mentioned? And in particular, what are some of the opportunities that we have in Europe, as well as some of the key gaps? This has already been mentioned by several speakers. And in a way, I think it's important just to reiterate the fact that it's kind of strange that we don't remark more or problematize more the fact that globally men on average die 5 years younger than women do. And it's important to recognize that this isn't, I think, as Alistair reflected, something which is in particular places, it's a global phenomena. I think it's also worthy to highlight that there are clear gaps in terms of differences between countries as well as differences within countries. And there are intersecting disadvantage in particular, whether that's class, socioeconomic status, race, and a range of other factors that impact on men that mean that some men do much worse than others do. And I think as we think about these averages, it's really important to remember that in some parts of countries and in some parts of the world, men die significantly younger than just the 5 years difference that we've talked about. But why in particular is this happening? What are some of the key leading causes of men's premature mortality? And looking again at this slide, the previous slide was data from the UN, men in blue, women in orange, and this is data from the World Health Organization 2024, looking at the leading causes for the probability of premature death for men and women 30 to 70 years old. And you can see a story across all of these areas: cardiovascular disease, cancer, chronic respiratory disease, diabetes, injuries, and suicide, that men have a greater probability of premature death, quite significantly in some areas such as cardiovascular disease and injuries. Suicide has already been mentioned by both Alistair and Sasha. And so what this slide seeks to say is if we want to deal with men's health, we have to deal with non-communicable diseases and we have to deal with these challenges. And we have to really take seriously these challenges as an important part of improving everyone's health. And I think as part of that is an essential narrative that says, and building again on where Sasha and Alistair left us, that men's poor health is a public health issue. It's not about individual blaming of men themselves. Clearly, there needs to be behaviour change, but it is about the fact that it's an issue that affects everyone. Mortality and morbidity amongst men prematurely, in particular, is a loss of one's male partner, of a dad, of a brother, of a male lover, of a male friend. And we know that that's not only bad for men's health, it harms women and families, whether that's a loss of income in a family, whether that's the caregiving burden for a man who's ill. But also we know, and data from November across a number of countries has showed us that there is a physical, emotional, and mental impact on women's health due to caregiving for men who are in poor health, and including an impact on their employment. And I think critically, and this is particularly important as we engage policymakers, the preventable deaths amongst men that I've talked about, particularly in relation to the leading causes of non-communicable diseases, cost economies and societies billions annually. And this figure of just 6 countries in 2023 found that $379 billion could have been saved were there to be better interventions and approaches on preventing men's premature death. So if you don't believe that it's important because of men themselves or for others, it's critically important, I hope, that you will hear and understand for the impact it has on societies and on health systems and on public costs. But it's preventable. I think the key message that we want to leave from this webinar, and as you've heard already, is that men's health outcomes are not inevitable or biologically predestined. So often in this conversation, people say, well, isn't it just the case that men's health is bad? There's nothing we can do about it. But it is entirely preventable, whether that's at the individual level, thinking about improving physical and mental health. And we've heard some great interventions from Sasha and Alistair in terms of activities doing that on the ground in the UK and in Germany, whether it's shifting behavioural and gender norms, which can often impact and discourage men from seeking healthcare, or often only seeking healthcare at a critical or serious stage, whether that's actually reorientating health services to be more male friendly, recognising that often that we find that health services are not as skilled and also as not as accessible as they may be to men, and particularly men with intersecting disadvantage. And also policies, the area that we work on, particularly at Global Action on men's health, and the need for better policies that recognise the gendered specific needs of both men as well as women in relation to health. We do have a good story to tell in Europe. There's a strong foundation from which we can build. Sasha mentioned the WHO strategy on the health and well-being of men passed in 2018, which provided a really excellent framework for countries to move forward. Very few, unfortunately, have to the extent that the WHO aspired for them to do, but nevertheless, I commend that document to you in terms of its depth, but also its aspiration. And I think it's a really important and helpful starting point from which this work can continue to take forward. We've heard about the growing momentum globally amongst countries to develop national men's health strategies. Ireland being the first, as Sasha mentioned, and the fact that we've seen improvements in men's health outcomes in that country. Very proud about the England strategy last year, and we've just had a commitment from Canada. We currently have 9 strategies on men's health nationally around the world, and we hope as Global Action on Men's Health, as Peter said, that we can continue to increase that, particularly in Europe. We have good practice at a European level. The European Commission Beating Cancer strategy plan has very important commitments around men's health, prostate cancer, and also commitments around HPV vaccination for both boys and girls. And Europe has a good story to tell, an area that we work on significantly as Global Action on Men's Health in terms of increasing uptake of vaccination for boys as well as girls. And there is a really good story for European countries around this. So of course, vaccination rates need to increase across the board. And lastly, there's a number of research studies and initiatives that are ongoing in Europe, which we hope will lay the foundations for much stronger policies around men's health. For example, Praise You, focusing on prostate cancer, which we will hope will encourage national screening programs on prostate cancer across the European region. So we do have a strong basis on which to build. Nevertheless, there continues to be key gaps. And I think reflecting what Alistair and Sasha said, this is not just a phenomena to Germany or to the UK, it's across Europe and globally. We find, and you can see our reports down the side of the screen, our policy analysis on what sexual reproductive health, on cancer, on mental health, on primary care, as well as cardiovascular disease and online harms, including also cancer and prostate cancer, as mentioned, don't sufficiently address the gender-specific health needs of men. Policy does not, and there's a limited focus on this issue. And there's a need really to think, as was mentioned, about how we strengthen the policy framework around this issue. There's weak focus on prevention and early intervention. Men are often framed as problems rather than also having problems. Gender in policy is often synonymous only with women, and this is not about a zero sum, but this is about recognizing that, as is mentioned, there are important gender-related challenges for men as well as for women that need to be reflected. There's insufficient focus on masculinities and health-seeking behaviors. Different groups of men, particularly subsets and the most disadvantaged, are often invisible. We see poor sexist aggregated data and policies, and very infrequently there are targets. And if you don't measure something, if you don't have a commitment to it, then you can't show progress and you also don't fund something. And so it's really critical that policies not only have commitments around this that are measurable, but they also then are implemented. And for example, the WHO framework, as mentioned, is a great strategy, but it hasn't been sufficiently implemented, the 2018 framework. Germany plays a really critical role, and we're absolutely thrilled to be having this webinar for that reason. Not only the potential in Germany itself in terms of the work that can be done and many of the work that Doris and colleagues have done, which we're going to hear about immediately after me, but also the leadership role that Germany plays. Germany is well known for its leadership around global health, gender equality and women's rights, and the huge opportunity to connect onto that, a stronger focus on gender responsive healthcare, including a focus on men's own gendered health needs. There's existing research, existing forums. You've got a foundation and network that you can build on here. And I think that leadership opportunity is so important. You know, the very fact that the World Health Summit is in Germany, the very fact that Germany is always at the table in global health conversations provides a unique opportunity for you as German stakeholders and actors and as the German government to take leadership. And we hope to build that momentum towards a national strategy. And finally, what are we doing about it as Global Action on Men's Health together with our partners? And we would love to engage with you all in this webinar, to work together, to really continue to strengthen this case. We will continue our work around advocating for boys' HPV vaccination together with our partner No Man is an Island, Race to End HPV. We have plans for a global prostate cancer initiative, in particular working with the WHO around strengthening its policy framework on this area to provide guidance for countries. We would like to partner together with support from Movember to build a European coalition on men's health. Also, together with Movember, we plan a European report next year on the real face of men's health in Europe. There's potential for a Germany-specific report on men's health, where we hope that we can potentially have additional economic data to strengthen the policy case around the economic impact of men's health. We will be back at the World Health Summit, as I mentioned, and we will continue our advocacy nationally and internationally and within Europe, together with our partners such as GHHG, the European Cancer Organization, and EUA. So thank you very much indeed, and back to you, Leonie.
Thank you so much. Thank you for filling us in about your work, and it's very impressive. I at least learned a lot, and thank you also for reiterating that Germany can play a leading role here. I'm sure Mr. van Beek is happy about hearing that and seeing so much support for him and here to build this momentum. First and foremost, of course, this is the Stiftung Männergesundheit in Germany. So we are curious to hear from you, Doris, about what you're doing in your foundation and some findings actually from your male health report.
Thank you. Tim, please, my slides.
Yes, I think Tim will show them in a bit.
Okay.
Yes, I see it coming.
It's coming. Okay. Deutschland braucht eine Männergesundheitsstrategie. Let's start with this. Thanks to Global Action on Men's Health and GIS and you from Global Health Hub Germany, efforts to support a men's health strategy in Germany. Therefore, we need an inventory to see which experts and institutions are still available. The next slide, please. The Men's Health Manifesto was signed by 3 organizations. You see here the Foundation of Men's Health, the Boys and Men's Health Network, and the Federal Forum for Men. And in a working group for this men's health strategy, they worked together. Who is still available and what they are doing now? The next slide, please. The Men's Health Foundation has consolidated its profile in recent years, which should be modules for a men's health strategy for Germany. And I will list up. That's the first, the representation of the interests of men's health in social media, in television, in podcasting, and so on. And then regular reporting about men's health in key issues of men's health with 6 reports up to 2025. And then systematic and ongoing production of knowledge articles. That's Wissensreihe Männergesundheit. You see here 40 guides, and some of them are listed here, each with a print run of 10,000. The focus on International Men's Health Week. This year marks the 9th anniversary under the topic, Loneliness is a risk, togetherness is a resource. Our concept was praised by the participants of special workshop of Global Action of Men's Health last month. The next slide, please. we founded an advisory board on men's health in August last year. And you see that we are coordinating now 12 men's health, 2 being set up, and 3 online networks, men's health. We have advisory board with 7 members, and this work is very important, I believe. Unfortunately, some of the problems facing the Men's Health Foundation have not yet been resolved, and they are listed here. In the summary, we have the main problems with the lack of funding and insufficient manpower. Added to this is a lack of support and cooperation from policymakers and the government. The next slide, please. That is the Network for Boys and Men's Health, the second institution, which worked on the manifesto. It's operating since 2005 under the leadership of Gunther Neubauer. In the last years, he works more on the level of the Land Baden-Württemberg, very active, I believe. Mr. Neubauer would be very glad to support the global action of men's health efforts at the national level in Germany. That means he would support the ongoing of men's health strategy for Germany. The next slide, please. The Federal Forum for Men, the Bundesforum für Männer, is the advocacy organization for boys, men, and fathers in Germany. It is affiliated with the Federal Ministry of Family and funded by this ministry. And health, you can see it here, health is one of the Federal Forum's key areas. One of its important and current projects is entitled Promoting Sustainable Masculinity, Overcoming Toxic Masculinity. The Federal Forum coordinates approximately 40 organizations that focus on issues related to boys and men. Unfortunately, due to a lack of experts, there is no focus group on men's health or on men's health strategy. Currently, they do not have a mandate to develop a men's health strategy. The next slide, please. The activities at federal level. From 2012 to 2020, you see here, there have been a lot of activities. And then you see 2014, the Robert Koch Institute published the Men's Health Report. That was a task from the Ministry of Health, but it was published by the Robert Koch Institute. That's the only men's health report in this period published by the government. In 25, you see, the discussions began regarding a gender equality strategy and an action plan for women's health. And this is where connections can be drawn to the implementation of men's health action plan and a strategy to coordinate these activities. I believe that should be possible. And please, the last slide. What could be the next steps for Germany? And we listed here up, define the political responsibilities. Bring together all those involved in men's health. Designate a lead organization. And organize conferences and develop strategies in collaboration with international organizations. we think that should be possible after such webinars like today here. So we have now opportunities to develop an action plan for gender equitable healthcare. This is under discussion now, and I think that would move the Men's Health Manifesto traditionally forward to a men's health strategy. And our statement regarding today's webinar, the Foundation of Men's Health and the Boys and Men's Health Network are offering their support for the development of a German men's health strategy. Thank you for your attention.
Thank you so much, Doris. Thank you also for filling us in about all the complexities and the ups and downs historically on the men's health topic in Germany. I'm glad that now it seems that there's a lot more attention again and also a lot more energy we want to use. So we reached our second Q&A session, and there are still a couple of open questions in the chat box. But we also have one large comment on the relevance of nurses in our healthcare system. So why not talk to that first? And since it's a long question and probably many thoughts on it, I would like to hand over to Tim from Global Action on Men's Health Network to share your thoughts on the comment you can see on the representation of nurses and the relation to men's health.
Yeah, great. And Ian, thank you for that really excellent and important question. And Doris, just to say thanks for your great presentation. I'm so glad that you were able to highlight much of the work that's already happened in Germany, and I really hope that we can build on that, and particularly in relation to the commitment from Sasha Van Beek. But I mean, Ian, yes, the frontline health professionals play a critical role. I think it was important that the men's health strategy in England highlighted the importance of capacity building and engagement with them. And at Global Action on Men's Health, we've been doing particular work around pharmacy as an example of a part of the health system where we can engage around the role of pharmacists in improving men's health. And I think there's a lot that can be done with nurses and with the nursing profession. And we recently were able to have a meeting with the Royal College of Nurses, which was great around what more can the nursing profession in the UK and globally do around men's health. But I think it is a significant opportunity if we can provide nurses with the appropriate tools and training. For example, a toolkit around what more could nurses do to improve men's health. I think there are real opportunities there. I think especially as we think about the fact that nurses or men often prefer to access care at more local levels, and the kind of mantra around kind of going where men are at. I think there are huge opportunities in terms of directing the kind of the health provision locally, and nurses will play a really critical, important role of that. I also think your point about misogyny is really important, and I think part of that also highlights the importance of us to encourage men to move more into caregiving professions and to professions such as nursing, and to highlight that these professions are an important role for everyone. And I mean, I think the same applies to teachers and other professions that are often, lower paid and are often seen as kind of women's work. And we need to kind of champion those areas of work. And I think if we can bring more men in and we can highlight really the important role of men's health, I think that's an opportunity to highlight that in caring for men, that they can care for others. And I think that that's an important way in which we can push back or kind of challenge some of the harmful aspects of misogyny. So thank you for that really important question.
Thank you, Tim, for the answer. We also have a couple of questions still on the involvement of other groups. Of course, we have to not forget LGBTQ plus men. Thank you for that comment. I think this is super, super relevant and should never be forgotten. But then also migration sensitive approaches should be part of the strategies to be developed or that are already out there. So thank you for these reminders. Are there any more questions. I don't see any open questions, I think, directed to Tim or Doris in the chat box at the moment.
Maybe it's. Could I ask Doris to say more particularly about the work that they did both in terms of the manifesto on men's health 2021, but also the men's sheds work and kind of what you're doing in Germany around that and opportunities for any global connections.
If you read the text of the manifesto, you find the declaration of the WHO Europe from the year 2018. That means this manifesto has an actual situation up to now. And to use this manifesto for ongoing tasks would be very interesting and very important, I believe. But the men's sheds, we started because from our international contacts with Global Action of Men's Health, we heard about the men's sheds, and then we studied the experience and the success in other countries. And in 2023, we had the International Men's Health Week in connection with men's sheds, and we invited Noel Richardson from Ireland, and we invited Mark Winston from United States to give reports about their development and success and effect to health situation of older men. And after this, we decided after the Men's Health Week in 25, we decided to develop a board for men's sheds and to develop this for Germany. That was not actually in Germany. We had some men's sheds traditionally, and now we have a development of new men's sheds, and we think that one day, in connection maybe with the men's health strategy, we will have an association for men's sheds, and that is something like a connection between social situation of older men and health effects which we can have when we have more men's sheds in Germany. That would be our proposal. That is one of the modules for a men's health strategy. In United Kingdom, that is a module. In Ireland, the development of men's sheds is a module of the men's health strategy, and that is our proposal to use it for a men's health strategy. Okay.
Thank you very much, Doris. It sounds very innovative and very inspiring. Thank you for sharing some details on that. I have actually overlooked one question in the chat. It was supposed to go to Mr. Strathern, but Tim, I would pose it to you. Maybe you also can speak on it. Do you know if the UK strategy includes some support to men also to become psychotherapists? Because Mr. Strathern also talked about that hurdles, that sometimes it's not so easy as a man to talk to a woman and the other way around. Is there anything included in the UK strategy?
I think there are broader commitments generally in the UK around how we improve the provision of mental health, and I think, as Alistair said, mental health services in the UK are not good enough, are insufficient, and I think part of that is thinking about how there would be more psychotherapists and encouraging men to go into those professions. But I think the key next step really is kind of how that then is put into practice, and I think that's the piece that still needs to happen. How do we then practically ensure that more men do go into those professions that they're then supported, and I think so that is the journey that the UK needs to be on, and I hope will be on. But I think it's something definitely, Simon, thank you for flagging that. It's a really important question, and I think it also relates to Ian's earlier question around how we encourage men to go more into nursing, that we need to, across all those professions, to try and ensure that we can have men and women working together. So I think there's aspirations, but I think there's a long way to go.
Yeah, thank you, Tim. And then there's also, sorry, Doris, please.
Can I add something? In the manifesto, there was written that task number 1 for amelioration of men's health would be mental health and well-being. And now when we prepared for today here, the presentation, we thought that the mental health is up to now as the first task for a men's health strategy for Germany. Okay, that was an addition.
Yeah, thank you very much. I see one more question in the chat before we have to come to a close, and this is related to a point Tim made. And maybe, Tim, do you want to speak on it? It's about promoting healthcare and teaching education to men, and if there are actually any programs to do that in the UK and in Germany. Maybe you can speak to the UK, and then Doris can speak to Germany.
I think I would hold up many of the kind of community-based interventions which Alistair mentioned in terms of improving men's kind of health literacy and education. But I think there needs to be more in terms of healthcare kind of provision and information. I mean, we do a lot of work on sexual and reproductive health, for example, and one of the key barriers or gaps is that healthcare practitioners don't really have sufficient knowledge and skills around the kind of whole area of men's sexual and reproductive health, such as male infertility, sexual dysfunction, and other areas. So I think there are certainly big gaps, and there's no kind of comprehensive training approach, although the men's health strategy in England does really recognise the importance of skilling up the health workforce, and I think that's critical. But again, coming back to the same kind of question, Lee, there's more to be done in that area. Thank you. Mm-hmm. And I think Germany, it would be interesting to know as well, Doris.
We would be very happy when the development in Germany would be a very good development of women's health strategy and action plan and men's health on a very good level and a cooperation between them. I think that is very important for the well-being of the population in Germany, and the support, the international support and the activation of the Ministry of Health and of the federal government, of the Abgeordneten like Sasha, that's very important for the next years.
Thank you, Doris, for these actually perfect and inspiring last words for this webinar. We can't achieve anything alone here. We have to win change maker for the topic. We have to create some noise, similarly to what we do now. And the work you do at the Stiftung Männergesundheit and obviously also at the Global Action on Men's Health is super important and a step to the right direction. You can find a lot of resources in the chat. People posted reports, data sets, links to websites. So if you want to dive deeper, please go in there and read through what you find. I would like to close with a last question to all the participants who are still there. We lost a few, but maybe if you would like to share what you took with you from that webinar, the one main thing that you take away from this webinar, you can post it in the chat now, while I just tell you a little bit what we want to do after this webinar, how it will continue both at the Global Action on Men's Health, but also at the Global Health of Germany. My colleague Corinna at the beginning already said that we will have a conference in July where we also want to look at gender-related barriers to health, both for men and for women. It will be followed by a keynote speech by our federal minister, and it will take place in person in Berlin. So if you're interested in participating in that event, you find the link to our website in the chat, and then you can become a member. It's free of charge, and you will receive the invitation via email. So it's 7th and 8th of July. The Global Action on Men's Health is doing a lot of work and is currently also trying to increase the European collaboration, as you can have heard. So they are absolutely open for collaboration. So if you are interested, you've also find the link to their website in the chat. So reach out and get involved. There's a lot of opportunities for engagement. And of course, if you can't get enough of this topic, you find the recording of the webinar on our websites, both the Global Action on Men's Health and also the Global Health of Germany. And with that being said, I briefly look at my fellow organizers. If there's anything else to be said, if there are any last remarks or questions you want to raise. But I don't see or hear anything. And then I guess it just leaves me to say thank you, everyone. Thank you, Doris. Thank you, Corinna. Thank you, Peter. Thank you, Tim, for speaking. Thank you for also keeping the discussion alive and bring it back to the parliamentarians, we in Germany, to Mr. Van Beek, and you in the UK, to Mr. Alistair Strathern. And I really look forward to continuing this discussion in another forum very soon. Thank you very much and have a nice afternoon.
Bye.
Bye.
Thank you, Leonie. Thank you, everyone.
Thank you, Karina.
Thanks.